Guys, wait, are we on? I think we're on. Ashley with Amare. Hello. All right, so I want to put something in perspective for you guys, because when I ask you like how much fat you've got taken out and all this stuff, you guys have no idea because you don't understand doctor language. So I'm doing a bunch of these videos with like surgery lingo, and this is one of the ones that I feel like nobody really knows what they're saying when they talk to me because your doctor doesn't explain it. Okay, so when you get lipo, right? And they say they take out a certain amount of liters of fat. That does not equate to the amount of weight that you're losing. First off, let's start this video by saying plastic surgery is not weight loss. That is bariatric surgery. That's a gastric sleeve, gastric bypass, all of that stuff. This is like, if you're doing lipo, you're sculpting. It's about how you look. It's your shape. It's not about how much you weigh. So by saying, oh yeah, my doctor took out 5 liters, why am I still the same weight? Like, what? Dude, because it's not weight loss surgery, it's sculpting. Okay, anyway, and on top of that, guys, think about this too. If you're getting lipo and a BBL, the fat they took out from your stomach is going back into your body, in your booty. So you're not gonna lose weight, you're just moving the weight around. Anyway, that's a side note. But what I want to talk about is when they do lipo, they say they take out a certain amount of liters, right? Like that's like how much fat they're taking out. And then when they do a BBL, they say they put in, you know, like 1500 cc's or whatever, right? How do we know how much that is? Like, how do we know how big that's going to make you, right? So a couple of like different people that I've had are like, well, she got the same amount of cc's as me and looks totally different, or her butt looks bigger. It's placement. It's where they're putting the fat. I recently did a video last week, I think I posted on skinny BBLs, on how it's for people with a lower BMI who take out less liters of fat, liters of liposuction taking out, and put the fat strategically in the BBL area to give you shape and maybe a little bit of projection, but most of the times it's just shape around the outside of your BBL, around your hip dips, on the bottom of your BBL area, right? So somebody like that is not getting as many liters of lipo taken out, of fat taken out, but they're strategically placing it into, yes, I did that last week. Thank you for keeping me on point. They're not placing it all in one area to make it just look like a big piece back there. So let me break down some technical things before I continue rambling, because this was totally unplanned, but I just had a client and I needed to tell you guys. So when you're talking about liters of fat, right, you guys have no idea what that looks like. Like a liter of fat. You just see the canister and you're like, oh, okay, look at all that fat in there. Wow. But you don't know how much that is. Like in your head, it doesn't make sense as to how much fat they actually took out. So here's a water bottle. It's a liter. This is a liter water bottle. Okay. This whole thing is how much fat they're taking out of you. This is 1 liter. Okay. Picture like 5 of these. That's 5 liters. That's a lot. Like if this whole thing was, oh, there's still water in here. If this whole thing was filled with fat, that's a lot. That's a lot. If you guys ever pick up like a liter water bottle and feel how heavy it is, that's a lot, right? But then they don't say they're putting 5 liters in your BBL. They say cc's, which is cubic centimeters. Why do they say that? So a liter is a liquid measurement of water, liquid, fat, right? And they're taking that out. When they do the liposuction, I have another video on this. When they do the liposuction, they fill you up with tumescence fluid first, and then that's to help with pain and bleeding and a bunch of stuff. Go watch the video. The tumescence fluid is in there on top of your fat that's in there. So they go in, they take out some of the tumescence and the fat. As I explained in last week's video, when they do a BBL, they put it in a centrifuge, they spin it, they separate the fat, the good healthy fat cells and good stuff from the tumescence fluid and whatever else they're using for the surgery, and then they put that fat that's solid into your BBL, which then becomes cubic centimeters, cc's, which is now a measurement of a solid material, which is the fat, not liquid. So when they say it's liquid gold, yes, it is, you know, liquid. It's fat cells it's taken out of you. It's not like they're just, you know, putting a brick inside of your BBL area. But that's why they have that difference in measurement, because I'll ask you guys, well, how much lipo did you get take out? And you're like, oh, well, I had 1500 cc's in my BBL. And I'm like, okay, but how much lipo did they take out? Because it's not the same thing. It's not the same measurement. So when you're talking about liters of lipo, right? So we know that like generally, and I always say generally because every practice and every doctor is different and every state is different, when you are taking out 3 to 5 liters, 3 to 5 of these big things of lipo, they put a drain in because you're going to have bleeding. I use a JP drain. Or they'll leave your incisions open so you drain all the tumescence out of you. Fun fact, that is not swelling. That is just tumescent fluid. That's not going to stop your swelling. Having a drain or anything like that. There's a whole nother video on that too. But they're putting, because they're taking out so much of this fat from your lipo, they put in a drain to help with the bleeding. So think about 4 of these is a gallon, like a gallon of milk. 4 of these liters. So it's really 3.8. I think it's like 3.85. But let's just round it up and say 4. 4 of these is equivalent to a gallon of milk. 4 liters of liposuction is equivalent to a gallon of milk. That's a lot. That is a lot of lipo. You're going to have all that empty space where the fat used to be fill up with swelling. And you're going to swell a lot. So the more liters you take out, the more swelling you're going to have in that area because you don't have any fat there, number 1. Number 2, it's a lot more trauma than if you're doing like a liter or 2 liters, which is just 1 of these, or 2 of these versus 3 to 5 of these. If you guys on the Spotify can't see me, I'm holding up a 1 liter Dasani water bottle. And then of course, 4 of these is a gallon. Or, a little bit over a gallon. So, gallon of milk, think like a milk jug or a gallon of water. Now, when they spin that and they take it out, depending on how much of that they're using for your liquid gold BBL, that's when it becomes cc's. So then they'll do 800 cc's in each cheek, or they'll do 1500 cc's in each cheek, depending on how much was taken out for the lipo. So this is where it gets a little tricky. Just because they take out 4 to 5 liters doesn't mean they're going to fill your BBL with 4 to 5 liters worth of cc's in that area. Because again, sometimes we don't want it that big, right? Sometimes we just want a healthy, natural looking BBL. Just like a normal, went to the gym, did a little bit of squat action, rather than like this big projection thing, which is why they have different measurements. It is very, 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 very important for you to know how many cc's they're putting in your BBL and how many liters they took out for your lipo. Why? Because then that's going to tell us, because again, just because they took out so much lipo doesn't mean they put so much in the BBL area. Vice versa. They may have taken out a lot, like 3 liters from your stomach area and maybe like a liter together between your arms and legs. That's going to let me know, okay, your arms and legs aren't going to have as much swelling as your torso, your 360 area, because that had more liters taken out of it. It had more trauma. It had a lot more swelling that's happening in there. So that's something for you to look out with your healing for, which is why, again, it's super important for you guys to ask your doctor, how many liters did I get taken out? How many cc's did you put into my BBL? How much do I have back there? Because that's going to help you gauge, okay, I know, like I said, my arms and legs have less. They're probably going to be a little less sore. They're going to heal a little bit quicker. Whereas my stomach may take a lot longer because I had 3 liters done from that. My BBL, I have, 800 cc's or I have 1500 cc's. If you're doing anywhere from like 4 to 5 to 6 to 800 cc's back there, yeah, you're going to feel some pressure. It's going to hurt. It's going to be swollen. But if you're doing 1500 in each cheek, you're going to have a pretty serious BBL. You're going to have a lot of swelling back there. It's going to be really, really tight. It's going to feel really, really hard because they put a lot of solid mass back there. That's what cc's is. I want you guys to think of like when they say 800 cc's, like 800 pieces of solid mass. Whereas it's lipo, it's liquid. So it's liters. So they're taking out. But it's really important for you guys to know because, again, with that process, I have seen BBLs that take, even with us, 10 weeks, a little bit over that 6 to 8 week mark because there's so much back there. It's so dense. So it takes a little bit longer to start to soften on top of the swelling that happens back there because, again, it's a lot back there versus the guys who are like done at 6 weeks, totally finished completely, only had 600 cc's in the BBL area. Doesn't mean that they still didn't have that pressure. Doesn't mean that they still didn't have that time that they needed to heal where it was still kind of like ouchy back there. It just means that they had less, so their body healed a lot quicker. As with anything, if we're doing less, we're going to have less of a healing time. With BBLs, as we know, as I say all the time, still that 6 to 8 week mark, do not mess around with your healing and your massages and sitting on that thing up until that 8-week mark. And when you're with us, if I check it at that 8-week mark and I'm like, it's still a little firm back here, you still got some swelling going on, we're still trying to heal, yeah, we're pushing you out to that 10-week mark where you're not sitting, you're not laying, you're not putting pressure on that BBL, because again, depending on how many cc's you had put back there, how much they did, that's going to matter on how you heal. Now, it's not just the numbers game, because again, you could have had 5 liters of lipo and had, maybe 1 on your legs, half on your arms, and then like your upper back, lower back, middle back, stomach, and it be even, little amounts, but evenly distributed over a lot of areas. So it's not going to be as intense of a healing thing. Same thing with your BBL. You could have had 1,000 cc's put in, but they're not putting it directly into the back of your glutes. They're putting it on the top, they're putting it on the hips, they're putting it on the bottom, they're putting it on the sides, they're filling you out in the back. It doesn't mean just because you're getting a lot done that you're going to have massive amounts of swelling. With taking out and putting in, it's how they do it, which is why you can't just go on YouTube University and follow somebody's experience, because whoever's doing their surgery and wherever they're getting the surgery done on their body is going to be completely different from yours, which is why your healing process is completely different. Because again, you both may have had 3 liters of lipo taken out, but yours was evenly distributed over your arms, your legs, your back, your torso, and theirs was just in their stomach. It's a very, very different thing as far as healing goes and where you're swelling and how much work was done. Same thing with BBLs. Skinny BBLs, you can have 800 cc's distributed evenly, or you can have 800 cc's plopped right in the center because you already have hips and stuff, and your healing is going to be totally different. Your pain is going to be totally different. Your swelling is going to be totally different. So when you guys hear, I'm trying to keep this short, wrap it up. When you guys hear 4 liters of lipo, I want you to think of a gallon of milk. It's that much fat that's coming out. When you hear 800 cc's, know that that's not the same for everyone. That doesn't mean you're getting 800 cc's right into the back. That could be around the hips. That could fill out the hip dips. That could be a little bit more to the front. It could be a little bit more underneath. That's not the same. That's depending on where they're putting the fat. But I want you guys to break this down so that you understand what you're asking your doctor when you ask, because you need to know. You need to know what was done to you. And you need to know what they're planning on doing too. And you need to ask questions so that you understand how you're healing. So again, liters of lipo, cc of fat. Same thing with any kind of fat transfer, even to the breasts. They do fat transfer to the breasts. And again, they're usually doing shaping. They're giving you like an extra cup size. They're giving you some cleavage. They're doing a little bit, underneath to shape you out and round you out. Could be anywhere from 200 cc's to 400 cc's. Same thing goes with breast implants, guys. Even if it's not fat transfer, if it's breast implants, and breast implants are a little bit different. And I'll do a whole video on the different sizes and what they are, because I know you guys see on Instagram, TikTok, Facebook, all these different things, groups that you're in, people's implants, or like doctors that are showing implants, like what the sizes are, or just if you go in for implants and you're thinking about getting them, they'll show you the different sizes. That's a little more standard, because that's just one area, whether it be silicone, gummy, oh my gosh, totally lost my train of thought. Silicone, gummies, or saline. That's what I was going to say. It's still that same cc's. Thing with breasts, though, is that not all of them are even. So on one side, you may have 300 cc's. On the other side, you may have 280 cc's, because they're making you even, because your mass already there isn't even, so they're evening them out. Some people don't want them even. They want them to look as natural as possible. So they want them a little bit different in size, but it's all going to depend on what you have and how you're shaped as far as the implant, as well as how big your chest already is and how much skin they have. If you are doing a reduction, an augmentation with implants, you got a little bit more to play with there. You can play with the size. But if you're someone like me who's got nothing, like at all, we got nothing going on here, it would have to be over time incrementally. I would not be able to do something like 300 cc's. I don't have enough skin to do 300 cc's. Even if they went in there and tried, it would need time for everything to stretch naturally, so there's space to fill that in over years. Or like with breast cancer patients, they do an expander or something like that. That's a whole nother video. We will get into the specifications of that later. But yeah, it's the same thing with implants when you're looking at sizing. It's cc's because it's a solid thing. It's not just like liquid floating around. It's a solid implant, like gummies are a solid implant. Silicone is a solid implant, so it's however many cc's. That's why it's not liters. That's why it's not the same thing, which is what makes it super confusing when you guys try to figure out, well, how much did they take from my stomach and put in my butt? Because you don't know the measurements difference for the sizing. So there's that. I will say, last thing, 1,000 cc's is 1 liter. So when you're talking about putting into your BBL, right, to know how much fat they put from your stomach into your BBL gluteal region, 1,000 cc's is one of these Dasani 1 liter water bottles. So when you're talking about 1,500 cc's, that means they only used out of, like, let's say the 3 liters of fat that they took, if they put together collectively, which they usually don't, it's usually one cheek and then the other cheek, 1,500 cc's each, then you're talking about like 3 liters, because 1,000 cc's is 1 liter. So 1,500 on each side, that's 3 liters. So that's all the lipo fat that they took out and put directly into your BBL. Now, if you've ever watched any of the Instagram or TikTok or anything like that where a surgeon is showing you, or even like before and afters where they mark up the glutes and it says like 1,500 cc's, that's 3 liters worth of liposuction fat that they spun, got the good fat from, and put it in your BBL. So you have 3 liters from your lipo area, wherever that is, that went right into your butt. So if you're talking about 1,000 cc's, that's a liter. If you're talking about 500 cc's, that's only half a liter from your lipo area. So when you guys say, you know, how many liters of lipo did you take out? And they say, oh, about 3, you know, or 4. Let's say they say 4. And you say, okay, how many cc's did I get in my BBL? And they say, oh, about 1,000 each side. Then you know, out of that 4, they only used 2 liters of your good golden liquid gold fat transfer fat from the lipo into your BBL area. That's how you equate how much they took out from wherever your lipo is and put it into your BBL. So 1,000 cc's is 1 liter of lipo. 1,000 cc's of fat transfer is 1 liter of lipo. So that way you know. Now again, it's a lot, but if you had, and I've never seen this because I don't think it would ever happen, but let's just say hypothetically, they put 5 liters, like the whole, 4 liters of lipo. Let's say they did 2,000 cc's each cheek. That's a gallon of milk, because 4 liters is a gallon. So they took a gallon of fat out and put it into your BBL area. So you're basically carrying around a whole gallon of milk. And if you guys ever pick up a gallon of milk and see how heavy it is, yes, that's a heavy BBL. And this is why I say 1,500 is a lot. That's a lot. Because 300, like 3 liters, which is 3,000 cc's, which is 150 each cheek, is almost a gallon of milk. It's 1 liter away from a gallon of milk. So when you're talking about weight, back to the original point of this video, when you guys are talking about losing weight, you guys don't realize how much this stuff is being recycled with your BBL and your fat transfer. You don't realize how heavy it is. So 4 liters of lipo is a gallon of milk. That's heavy. And then they're taking maybe half of that and putting it into your BBL. Those numbers on the scale are not going to go down. They're just being transferred. And on top of that, how much lipo they took out, you're going to swell in that area because your body is thinking, oh, there's a hole, we need to fill the hole, so it swells. But on top of that, anywhere that you're cut, your body swells to bring, white blood cells, fats, proteins, all the stuff to the area to fill up the hole and heal it. So you're going to have all that swelling on top of the fat that just got moved, which is also swelling. So now you've got the same amount of weight plus the weight from the swelling. So yeah, your numbers are going to skyrocket on the scale for a little while. And then when your swelling comes down, you're not really going to see much of a weight difference overall because, again, they just moved it from the front to the back. So I hope this all made sense as far as sizing for you guys and how much it weighs and how much it, how much they're actually moving around everywhere. And that's kind of how you can tell. And you can, again, look at other people, see before and after, see how much 1,500 on each cheek actually is, how big it is, because it's a lot. It is a lot. Again, a gallon of milk. That's a lot back there. So, guys, this was great. I will talk to you soon. If you need to set up a consult for questions, if you have questions for me, 732-841-0142. Alex will be happy to set you up with a consult. If you need lipofoams, if you need wound care, if your skin is flaking, if you need proper arnica cream, not the Boreon white stuff in the tube that is store-bought, that is not strong enough for post-op. Head over to the online shop, check it out, watch the videos first so that you know what you're doing and how to use them and what you're getting. And that's it, guys. This will post on Friday. Thank you so much for listening and joining. And if you guys are on the Spotify, I would encourage you to check out the videos so you can get the visual of actually how much a liter of lipo is and how much that is. So that's it, guys. Thank you very much and have a good day. Bye.